Welcome to the second episode of Grand Rounds, the Healthcare Dollar. Today, we'll be covering the question, what are the different types of health insurance? There's so many reasons this is important to understand. It impacts what doctors can see you, how much you pay for your healthcare, and how incentivized your healthcare insurance is to decrease costs or improve care for you. At first glance, it can be a pretty complicated system, but we're going to break it down so that it's easy for everyone to understand. So at first glance, we can split our whole healthcare system financing into both public financing and private financing. So what this means is on the public side is some form of government contribution to your care, and on the private side, you're essentially buying it through yourself or through your employer. So to look at the public financing side, let's zoom in here a little bit. The public financing or public health care can be broken down into two sources, and sometimes three: the federal government, the state government, and the local government. And it can really make up an organization of all three of these. Now, the federal government and the state government have historically contributed to both Medicare and Medicaid. And so that's why you'll see this line for the federal government go through the Department of Human and Health Services and connect down to the center of Medicaid and Medicare. The state government also has its own line going down to Medicaid. So states don't really contribute to Medicare. Medicare is entirely run by the federal government. However, the state and the federal government both contribute to Medicaid, and that varies state by state. We'll have an entirely separate video on just understanding Medicaid because of how many different kinds of programs are in that one program. To clarify, Medicare is, again, run by the federal government. It's for anyone who is over 65 or who is on dialysis, and you pay into this through your payroll taxes alongside Social Security. Medicaid is for anyone below a certain income level based on the state, pregnant women, children, which is covered under CHIP, and people with disabilities as well. Other forms of government insurance programs that the federal government specifically funds include the Veterans Health Administration, or the VA, for, as you would think, veterans, and TRICARE, which is the military healthcare system for active duty military members. So all of these, TRICARE, the VA, Medicare, Medicaid, all of those can serve basically as insurance programs, and so they will give or reimburse your doctors for their care. Now, like we talked about in our last video, usually the reimbursement rates for these programs, particularly for Medicaid, are way lower for doctors than any of these programs. And quite frankly, a doctor who were to only see Medicaid or Medicare patients can't really break even on them. Now, if we go over to the private financing side, there's a few different ways to do that as well. The major way that America has established private access to insurance was back in the 1950s through your employer. So basically, as an employment benefit, you will your employer will pay for healthcare insurance, or they'll basically take it from your salary, and then they contract with insurance companies to provide you insurance. Now, we'll see a breakdown of this on the next slide, but sometimes employers actually, if they're large enough, they just act like their own insurance companies. So the incentives for those employers, if they're acting like their own insurance companies, is different than if they're purchasing insurance from someone else. So that's something to keep in mind. The other way that you can purchase insurance privately is through the marketplace. These are the marketplaces that the Affordable Care Act enacted to have certain plans that have minimum benefits. So you can go onto the exchange on the federal marketplace or the state marketplace and buy those insurance plans. Now, a weird crossover, and one that we'll get into more later, is that sometimes these publicly financed healthcare organizations, Medicare and Medicaid, actually contract with a private organization to administer the plan. So the funding is still coming from the government, but they're basically giving it to a middleman to actually administer the plan. Now, that wasn't so bad once you go through it, and this is one of the few graphics that I think really captures super well all of our different financing options. Here's a quick chart on really the latest breakdown on what percentage of Americans have what type of health insurance. The big numbers to look at are that 35 to 36% are on some form of public plan, and about 65% are on some form of private plan. So, but it's about a 2/3 to 1/3 difference. And remember, like we talked about, the costs of this public plan and the costs that these patients incur affect the costs of these private plans as well. They're all interrelated, even if you think that they're separate. To get into a little bit more on the private insurance coverage, as this really sets the stage for understanding who cares about, meaning which plans care about saving money and saving healthcare costs versus which plans don't. So in terms of the sources of private insurance coverage, there's a few different types. All the way on the right side, there's the more smaller local coverage plans, such as when you go to a university and there's a student health plan, or that might be a plan offered through your church. These are, usually for a pretty healthy population, aren't really the majority of people who are buying private plans. Most people who are fully employed get insurance through their employer. And even within employers, there's two different types. Some employers, just like individual consumers, they go to Aetna or United and they buy a health insurance policy for all of their employees. And that can be split between larger group employers and smaller group employers. Other employers actually basically insure themselves. So these employers, as you would imagine, are a lot more interested in controlling healthcare costs than maybe fully insured plans that are just contracting out from another insurer. The second big category that we talked about are the direct purchase plans. Within these, there are plans that are marketplace and quote-unquote Affordable Care Act compliant. And there's other off-marketplace plans, and these are ones to watch out for because sometimes they don't include all the benefits that any minimum health care plan should. I've heard of healthcare plans that only allow telehealth visits, or healthcare plans that only allow you to have 6 doctor visits per year. And so when you're picking a plan on your own, it's really important to see if it's compliant with Affordable Care Act regulations or not. Now, one thing that's critical to understand about how insurance companies make money, which will lay the foundation for understanding which kinds of insurance programs want to actually save money, both for themselves and for you, a concept critical to understanding that is the medical loss ratio. So what the Affordable Care Act put into place is that out of the total number of premiums, so if a company like United Healthcare gets $100 in premiums, they have to spend about 80% of that to 85%, depending on the exact type of plan, on paying actual medical expenses for their members. And that's called the medical loss ratio. So what that means is they can't just take your premiums and spend all of it on healthcare administration costs and not actually towards your medical expenses. And this sounds like a great thing. But on the flip side, what it means is that insurance companies basically are incentivized. So let's say the medical loss ratio is 80%. That means that 20% of whatever premiums they cover or whatever premiums they collect can count as their profit. So 20% of whatever pie they collect is their profit. If they collect more premiums, they still get 20% of those premiums. And 20% of a bigger pie is more money than 20% of a smaller pie. So it kind of locks them in at a guaranteed profit of 20%. And they get to choose the size of this pie, the total premiums. To see this in action, let's look at United Healthcare's income statement in this fancy graph. United is particularly a beast and could use its own podcast episode. But basically, what I'm trying to say is that if this pie increases of how much they're taking in premiums, they're allowed to take 20% of that pie for profit. So if the pie is only 114 billion, then they get 20% of 114 billion. But if the pie is 215 billion, then they get to take a bigger profit, and this increases. So they're not necessarily incentivized to decrease premiums because that's literally their source of income. So today we've really understood the foundation of the different types of healthcare insurance and some of their income and profit structure. So up next, healthcare costs are so high. Who actually cares about decreasing them? And why do insurance companies deny so many claims? Stay tuned to find out.